Hello, everyone, and welcome back to the Outcomes Rocket. I'm so excited you tuned in because we are having some amazing conversations. Today, we're having a conversation with a leader in the business of healthcare AI. His name is Ganesh Padmanabhan. He is the founder and CEO of Autonomize. Ganesh, thanks for joining us today.
Thanks for having me, Saul. Hope San Diego is treating you well.
Hey, man, you know what? In the winter months, Austin, San Diego, wherever you could go to keep the weather good.
Amazing. It's amazing. Well, good to be here. Thanks for having me.
My pleasure. It's such a pleasure to do this with you. Look, you do some really cool stuff, man. I want to level set by helping you educate our listeners and viewers on what it is that you do, your background, and a little bit about Autonomize.
Sounds good. So I am in the business of trying to make healthcare less shitty, to be honest with you, right? So
I like that. I'm in that business too.
That's true. I think, well, the good news is a lot of people are now very interested in that problem because I think we've climbed up the Maslow's hierarchy of needs of solving all of the problems to say now we have to put our efforts into solving healthcare. My background, very quickly, I'm an engineer by education, spent a lot of time in big tech. I was building software, hardware, systems at scale. Did a lot of that, founded a few companies and worked in startups and stuff. And about 4 years ago, post-COVID, couldn't unsee what was happening in healthcare. And the semi-joke I say is like, what am I going to tell my grandkids? Because I've been in AI and data for a long time. I can't just tell them that I help people shop more and search more with AI. I got to do something more meaningful than that. So then healthcare, what better mission to go align yourself to than to make healthcare better? So that's what we did. And the Autonomize is an AI company focused on healthcare. And what we do is actually we try to make the business of care, the infrastructure needed for the business of care, a lot more seamless by applying AI to operational workflows. So what does that mean? If you're in the business of care, if you're a healthcare provider or a payer or a value-based care organization, you're struggling with how do I manage my population? How do I manage my contracts? How do I do prior authorization? How do I do care management, claims processing, RCM? We have a collection of capabilities. We built AI agents for all of those different operational workflows and a platform to help them bring that to life and to really push the business of care to an accountable autonomy so you can actually deliver value and people are not just buried in paperwork and bureaucracy, but focused on healing and helping people in the business of care.
I love it, Ganesh. And today we need these types of automations in order to make care more scalable without the burnout. So walk us through what you think you guys do is different than what else is available out there.
Yeah, no, look, historically, healthcare, any industry, but especially healthcare, because it's so huge, it's so fragmented, right? So what we did as an industry was the last 15, 20 years, a lot of focus on digital health and health ID and health tech. We started solving problems in narrow silos, and we all created these islands of efficiency. Oh, here is a care management application. Here's a patient messaging application. Even though you solve the localized problems with those solutions, you didn't change the industry. You didn't change the structural problems within the enterprises or the industry, right? So point solutions does not scale. Last 10 years, all of these categories did well. But if you ask the average patient, has healthcare gotten better or worse? You'll hear them say it hasn't gotten any better. And one of the problems is like we solve those problems in very localized fashion without structurally. You're solving symptoms rather than problems. So that's one very unique way we think about this and saying we look at healthcare as an end-to-end ecosystem. You have payers, you have providers, you have PBMs, you have patients. And how do you orchestrate these agents to actually go do things that humans would take too long to do, may make mistakes, and they're not really operating at the top of their license if they do. But then not just solving those problems, but having a view of how it's all interconnected and providing that infrastructure to scale beyond just a point problem. So that's one thing that's very unique about us. The other approach to solving these problems had been historically build it yourself, get the hyperscaler software, get your Anthropic or Cloud API, because AI is now accessible for everybody, and then start building your infrastructure to do. But there's a big difference between prompting an LLM versus running something in a regulated industry in healthcare that solves real problems, integrate with real systems, integrates with legacy investments they've made over the last 10 to 20 years and so forth. So while you get a very quick time to value to solve a problem in an okay fashion with a large LLM and prompting. You need more context engineering. You need more industry domain expertise. You need to know how it overlays into operational business processes. You need to know how you can do clinical validation, regulatory hardening, provenance, data, compliance, all of that stuff. We provide a platform to go do all of that. So you leverage the best of breed frontier models, but then you're building specifically for the ground up that'll work in health. And the result for us have been pretty staggering. We power 3 of the 5 top healthcare enterprises in the United States. We work with several health insurance companies, health plans, health providers, healthcare providers, integrated delivery networks, value-based care organizations, and a wide variety of things. And we're making a huge impact to those enterprises, but also to the lives of the patients and members that they touch.
Yeah, I appreciate that, Ganesh. And for the customers that use you beyond the specificity, right? Because they're using you for something specific.
Mm-hmm.
But what would you say if they were talking to their friends at a cocktail hour? They say, man, you got to check out Autonomize because they do this for me. They unlock this for me. They make this easy for me. What would they say?
We specifically solve one particular problem, which is lower the cost of running operations that involve high cost FTEs. Doctors, nurses, caregivers, care managers and stuff, they are buried in paperwork. So if you're talking to a CIO might say, if they're talking in a party saying, those guys are awesome because they're the most healthcare native AI infrastructure I've ever touched my hands on, because they help me solve not just one problem on prior auth, but also extend the value of that into other workflows. If a CMO is in that particular conversation, the chief medical officer would say, look, because of Autonomize, we've been able to make sure that our nurses and MDs and medical directors are operating at the top of their license. So they're not doing swivel chair management of pulling information from multiple systems, reading hundreds of pages of medical charts, but actually making judgments and decisions based on how the AI assembles information, gives some guidance and evidence and so forth.
Ganesh, I love it. Thank you. I wanted to ask you another question. I'm very intrigued by your podcast.
Yeah.
You have a podcast, and the name of that, tell me what the name of that podcast is. Voices in AI? Or Stories in AI?
Stories in AI. Yeah, Stories in
AI. Tell me about that, man. Everybody listening, you guys know I believe in podcasts. They're such a great way to get insights, understand what's happening in your industry, network builder. Ganesh, what are you learning, man? And what have been the biggest takeaways in your last few interviews? I'm curious.
Yeah, no, look, first off, I think the podcast is called Stories in AI. It's on all the platforms. It's on Apple Podcasts, Google Podcasts, and Spotify as well. The podcasting is a very interesting mechanism, right? Because yes, there's videos and stuff too, but the big power is actually you have someone whispering between your ears. And if you're wearing a headphone and talking to it. So it's a very intimate form of how do you take a mass method of communication and make it very personalized. So I've been always fascinated by that. So I started Stories in AI in the middle of COVID, early 2021, mid 21, when I was just bored that I was not having those meaningful, deep conversations with people. So for me, it was a very selfish, very learning experiment to see how do I go talk to people I know, but also reach out to people I don't know and have an interesting conversation. And I had guests who were thinking about the safety of AI, which at the time in 2021 was not a very popular topic. Now it's very popular. I had the founder of Siri who sold it to Apple. Adam Scher was my most popular podcast. He talked about the interplay of AI and how it's indistinguishable with magic. I had a Stanford professor, Walter DeBrouwer. So Walter went into this whole exploration of how your AI behaves differently based on the way you behave with the AI. Now, today, like ChatGPT is probably extremely sycophantic, right? It'll just tell you what you want to know. Google is like very apologetic. And so everybody has personalities, but
I hate that. I hate that bot.
And then you have the other extreme is the bot from XAI, right? So it's just like, I'm just going to give it to you. But I think we should.
Oh yeah, have you tried that one? Have you tried that one? I haven't tried it. I got to try that one.
It's interesting. If you want to look at what is the public opinion, if Twitter as a feed is actually interesting to see this, it's a very good real-time prompting to find out the sentiment is a good way to do it. But it's also like very unvarnished, and it's very direct, and it is a very different style. But Walter went into this exploration of actually saying please and thank yous to those particular LLMs, changing the behavior and how it changes the embedding. And it was a very interesting thing. And I had this wide variety of folks, and I had very practical CIOs, chief data officers, think in financial services, how do they actually solve this for their particular industry and so forth. It's a wide variety of folks. Big lessons learned is like, look, everybody has a story to tell, right? And I think there's varying degrees of how people look at the same thing and approach it differently. So for me, just seeing, and you go into a deep exploration, just seeing that variety of thought process on the same common topic was just fascinating, right?
That's awesome, man. Well, I'm definitely going to have to listen to this one. It's called Stories in AI, folks. We'll link it up in the show notes to make sure you guys could check it out too. Sounds like a really good one. Hey, so let's get back to your business, man. Like, you're doing a lot of implementations out there. People are picking up on the tech, the value you're putting out there. What's one of the biggest things that you find clients run into that they eventually learn that you wish they would just know at the beginning of that implementation?
No, there's three things. Now, not one, but three things. One,
all right.
If software was never to say it is done, because you can always improve software and go build it and stuff, AI is an organism. It learns, it evolves, it changes and stuff. So one of the biggest thing, and I tell you, like, we've been very consistent in delivering 3 to 5x ROI to whoever we engage within the first 6 to 12 months. And a lot of that is a magical problem selection, go solve the hardest problem versus the easiest problem, stuff like that. But there is always the value realization curve doesn't look like this. It looks like this. And then it goes up, right? It just goes a little, and then it goes spiral up. And what is really happening, we've learned in these implementations, is there is a trust gap. And the trust gap could be the technology team saying, I tried this before, it didn't work. So how are you going to solve it for me? And they're not really opening it up. You do all the available data, all of that stuff. Or it could be it's a clinical workflow. The clinicians are used to actually being their behavior of verifying, double checking the actual document. They don't trust the AI to summarize it for them, even if you provide citations. And then there is the other extreme of the value realization is around, you would expect people's behavior to change overnight. It doesn't. So it requires active change management. So even if, like a classic example, a nurse is seeing a summary and a citation on that summary and where the source charts are, and either purely out of curiosity or lack of trust, they're always going to click that and find out what's happening there. So if you're measuring average handling time reduction, it's not going to come until they build that trust and then they go make this happen, right? So the value realization curve will not be a straight line. It'll be a curve that goes up like that. And once you unlock it, usually we see it about 4 to 6 weeks of actually implementation, roughly, depending on the use case and so forth. It just skyrockets. It just goes up from there. Second thing is, a prompt plus an LLM is not the answer for most problems that are worth solving in healthcare. What I mean by that is saying your context, the knowledge in the systems, the information all resides in systems of record, SaaS software, legacy systems in multiple places within an organization, especially in healthcare. Context also resides in people's heads, because if you want how to approve a wheelchair for prior auth, ask Sally, because Sally has done it for 30 years. There's a lot of that thing. So there is a lot of engineering involved in actually connecting to the right system, integrating with the right thing, mapping the data models and stuff, which people dismiss and people don't realize. If they're just coming in and say, I have AI, I can now do anything. The last mile of that integration and running it in production is the big unlock for delivering value. And the last thing I would say is, like, it's always going to be a team sport. And it's the technology team, the medical team or the clinical team, the compliance and the IT ops team, and the operational business unit, who's actually, they all have to go and have a shared incentive to go drive this. Because back to when I said there is change management involved, there's realization involved, there's people trust building involved. So it has to be approached in a team sport. And what we've done is, like, we deploy like a forward deployed team of experts from technology to operations to clinical that'll just be embedded with the customer for a period of time. So they get comfortable with this, they're comfortable with the change, and then we help them get over the hump. So that's the three things. Yeah.
That's great, Ganesh. What a great framework that you just laid out for us. Look, for all you leaders out there looking to do more with AI in your organization, deploying enterprise LLMs is not just, as Ganesh said, prompt and LLM. There's so much more. And you guys know this. But what I love talking about leaders like Ganesh is that they have the details from when rubber meets the road and what could go wrong. And if you could learn from other implementations that can help you save a lot of time and money, that's what you want to do. That's what networking is all about. And so, Ganesh, I really appreciate you jumping on with us. If you wanted to share kind of a call to action and the best place that our listeners and viewers could get in touch with you, what would that be and where can they get in touch?
So first thing, where like call to action, I would say, look, healthcare is in a point where I call it the kairos moment. The kairos in the Greek word is about like this precipitous time in history where it is an inflection point and a lot of things, decisions you make now can change the course of it, right? Technology has never been ready. The patients have never been so ingrained and informed in the systems, in the history of healthcare. And the margin pressures, the structural challenges of the administration, cost of care, the access to care, all of that equation has never been so strained in history. So we're in that kairos moment that it is time to embrace and time to actually just go deep and go fast with AI, because as a business, you don't want to be left behind. As a provider, you don't want to actually be like, it's going to be hard to compete with other providers. As a health plan, you have to figure out a way to carve out margins, or a PBM or a life sciences company and so forth. So timing is now to go make this happen. You now have a lot of tools to go do it, right? So embrace it, lean in, reach out if we can be helpful. We love to actually work with every one of you guys, all the listeners. And I think it's also a very beautiful moment in history, because what we talk about in healthcare being like very episodic and things, it'll all be very different in the next 2 or 3 years. You can either be a part of the group that gets affected by it, or you can be a part of the group that changes it and makes it that, right? So we want to be on the latter group, and we would love to have you join us for that. You can find out more at autonomize.ai. You can look at what we do there. I'm very active on LinkedIn, so please feel free to reach out. Mention Saul and the Outcomes Rocket, and I'll definitely connect. And I look forward to hearing from everybody.
That's awesome, Ganesh. Really appreciate that. And folks, thanks for joining us. What an awesome podcast here with Ganesh, founder and CEO of Autonomize. I particularly really love those 3 tips, the issues that pop up. And bottom line is value realization. So go check that with you and your leadership team. Check out the show notes with ways to get in touch with Autonomize and Ganesh. Thank you all for tuning in. And Ganesh, thanks for being with us, man. This was awesome.
Thank you for having me, Saul.